It's great to see such a great turnout. I've been working in the area of drug development for Alzheimer's disease for about 25 years. In our early efforts, there was some success with the approval of several drugs that are on the market today. But as we try to move towards new therapies that do more than reduce the symptoms, that actually slow the disease progression, we haven't been so fortunate in the outcome. Even though we have a good degree of confidence that we understand enough about the biology of this disease to know what to target with our treatments. We think amyloid is driving it. We think that the accumulation of tau tangles is associated with worsening of the disease. And even though we've had therapeutics, drugs, that target these processes, we have not succeeded in developing a disease-slowing drug. And in fact, no new drugs have been approved for the past 12 years. And yet, I am very optimistic about where we are right now, and that's the story that I want to tell you in just a few minutes. There have been big changes in the field. I want to talk about or mention two research tools that have really changed the business of drug development and Alzheimer's. They're both types of PET scanning of the brain. So traditionally, we could do CAT scans and MRIs that would show something about the brain structure, that could show that the brain shrinks with age and with Alzheimer's, but nothing specifically about the amyloid and the tau that form the lesions, that form the biochemical abnormalities underlying Alzheimer's disease. Well, about 10 years ago, a method was developed to image amyloid in the living brain with PET scans. The initial method had some difficulties, but additional methods have been derived from that first effort, and now we have available and on the market 3 different ways of imaging the amyloid plaques that are at the heart of Alzheimer's disease. This has made a huge impact on the disease, on our ability to study the disease and to develop treatments, because in the past we relied on clinical symptoms to identify people, and we were wrong a great deal of the time. And that makes it very difficult to test specific therapies. With amyloid scanning, we can be very, very accurate, almost perfectly accurate in identifying people with Alzheimer's disease. And in fact, by studying normal older individuals, we've discovered that this disease, the amyloid accumulation, starts long before the symptoms that allow a doctor to diagnose Alzheimer's. In fact, it starts 15 years before the symptoms. And since most of the drugs we're working on now target the amyloid that drives the disease, amyloid has actually been around for a long time by the time of diagnosis, and that may be too late for an intervention targeting amyloid to be effective, because the amyloid's already been there for so long and it's already done substantial damage. It seems to be too late. I think that's an indication, it's an explanation for why so many of our trials of anti-amyloid drugs in Alzheimer's dementia have been negative. The second tool that I want to mention is the imaging of the tangles, the second lesion. We all know that Alzheimer's disease is about plaques and tangles. In the past 2 years, we've been able to image tangles in brain. Now we can image the plaques, the amyloid that drives the disease, and the tangles that mark the progression of the disease. We have 2 fabulous techniques that have made clinical development of drugs much more straightforward. And it's allowing us to identify people and study drugs at this very early stage of disease, long before symptoms are present. We identify people using brain scans. And for our latest trials, in fact, we're not recruiting people on the basis of memory symptoms, but on the basis of positive scans in people who don't have any symptoms. We've just launched the first trial using these new methods and new techniques in asymptomatic people who have amyloid in brain. It's called the A4 trial, for anti-amyloid treatment in asymptomatic Alzheimer's. And in a couple of months, we launch A5, the next one, using a different class of drugs. I think this new approach is really a game changer, and so I'm very optimistic that the future looks good. Sorry for going over.